Having a loved one in the ICU is understandably very overwhelming, and it can feel like a lot is out of your control. That's why today I'd like to provide you with some information on a very common condition called ICU delirium, so that you, as a visitor of this patient, may be able to identify some key symptoms early on and also help to aid in their healing process. Delirium is a condition that many patients in the intensive care unit experience during their stay. It affects a patient's ability to think, concentrate, and pay attention in the same way they were able to before arriving to the hospital. It can be hard to detect, so it is very important that you, as their loved one, are able to identify some small changes in behavior that might indicate your loved one is heading towards a delirious state. Signs of ICU delirium may be noticeable if your loved one is suddenly acting different than they usually do. A patient with ICU delirium might experience an inability to concentrate on what you are saying. They may get easily distracted or confused. They may not know where they are or recognize people around them. Someone with ICU delirium could be easily agitated and unable to sit still. That could look like continuing to pull at IVs, oxygen tubes, or a mask. This patient may also be very anxious. ICU delirium could also look like someone who is suddenly withdrawn and does not participate in conversations or respond to you when you try to get their attention. Additionally, ICU delirium could present with someone who is suddenly sleeping way more than usual, or someone who can barely sleep at all. So now that you are able to identify that something is different with your loved one, what can you do to help them? The first thing you should do is to let the care team know what differences in behavior you have identified and express your concern. Let the care team know that you think your loved one is showing signs of ICU delirium. Next, try to reorient your loved one, as this can be very helpful. Bringing in an item from home, such as a picture of your family that they may recognize, and setting it up in the room is a great start. If your loved one seems confused, you can repeat some facts that may help them feel more calm. Remind them that they are in the hospital and in a safe place. Tell them the date and the time and the day of the week. Remind them who you are. Talk about shared memories or stories that may be comforting to your loved one, and even play some calming music from some of their favorite genres. Remember to talk in a calm, reassuring voice, as we don't want to overwhelm your loved one. If you are visiting during the day, try to open the blinds and engage with them. Try to keep them from oversleeping so that they may be able to sleep during the night. If you are visiting at night, try to dim the lights as much as possible and refrain from doing activities that might keep them awake. Hospital staff will still have to come in the room periodically to check on the patient and give medication, so do not try to prevent this. However, keeping light and noise to a minimum can help your loved one feel more comfortable and get the rest they really need. Overall, we understand that having a loved one in the ICU is extremely overwhelming. The last thing as the care team that we want to do is add to your responsibilities or concern. However, early identification and prevention of ICU delirium can really benefit your loved one's healing process and prevent them from having to stay in the hospital even longer. We'll provide you with a handout that summarizes the information we talked about today. Please do not hesitate to reach out to your nursing staff or physicians if you have any further questions or concerns about ICU delirium.